My name is Marcie Riches. I am the director of the bone marrow transplant program at the University of North Carolina in Chapel Hill. And I wanted to talk a little bit about the data that I presented related to one of our CD30 CAR T trials at the University of North Carolina. So the trial that I presented actually looked at using CD30 positive CAR T cells as consolidation following high-dose chemotherapy and autologous transplantation. For that trial, it was a phase 1 dose-finding trial, but we found some surprisingly good efficacy, particularly in our Hodgkin's lymphoma patients. We enrolled 18 patients in this trial that were treated. And for those 18, the long-term, the 1-year progression-free survival was actually 72% in our Hodgkin's patients. Unfortunately, we didn't see as good of outcomes in our T-cell lymphoma patients. We know that T-cell lymphoma is notoriously more difficult to treat. And in that vein, we actually have some other ongoing trials looking specifically at ways to improve targeting of the CD30 CAR for patients. And this is going to include the addition of a CD30 CAR CCR4 CAR T-cell. Hoping that the co-expression of CCR4 will improve homing to Hodgkin's lymphoma cells, and it is also open for our patients with cutaneous T-cell lymphomas. We also have a second clinical trial that's open that is specifically for our T-cell lymphoma patients who will actually receive 2 infusions of CAR T-cells. Neither of those are following transplantation, but are being utilized in patients with relapsed refractory CD30 positive Hodgkin's or T-cell lymphomas. We also have a pediatric study for looking at the same thing. I think that what's important is that in the setting both of CD30 CAR alone, as well as CD30 CAR T following high-dose chemotherapy and autologous stem cell transplant, we've actually had very low rates of CRS. And most of those were all grade 1 or 2, and we've actually had no neurotoxicity with our CD30 CAR T cells. So I think that from our perspective, this continues to be an active area of investigation, and are hopeful that we will continue to see improvements in outcomes. For the transplant trial that I presented, I think the next step is really going to be trying to see if using these CD30 CARs as consolidation after autologous transplant can provide us long-term benefit with a longer follow-up phase 2 trial. And also it'll be important to potentially compare that to what is current standard of care for patients with high-risk Hodgkin's lymphoma, which is brentuximab maintenance. Most of the patients in our trial had already received brentuximab, and so the utility of brentuximab maintenance in that setting isn't clear. And if we're still seeing efficacy with this approach, that actually will provide benefit for those patients who've already received targeted CD30 therapy using brentuximab